Medication. Any medication brought to school must have a pharmacy label that exactly matches the doctor's orders. Physician and parent signatures must be on the form. Check medication expiration date. Expired medication cannot be accepted. Medication received must be counted in front of the parent and documented on the back of the log sheet. Parent and case manager sign log sheet. Medication must be signed off by the school nurse before medication can be given. After validation by nurse, medication may be administered following the 6 rights: the right drug, the right route, the right dose, the right time, the right client, and the right documentation. When one or more of these rights goes wrong, it is considered a medication error. If a medication error occurs, the care manager must contact a school health nurse supervisor at the Cabarrus Health Alliance immediately, 704-920-1000. Facility policies and procedures must be followed when medication errors occur. Asthma. This is an example of an asthma action plan medication authorization form. There are places on the back of this form for both the physician and the parent to sign. In order to be acceptable in the health room, this form must be signed by the health provider and by the parent. Common asthma symptoms: coughing, wheezing, tight chest, breathing is hard and fast, nostrils open wide, can't talk or walk due to shortness of breath, ribs show. Emergency care for asthma. If a student says they need their asthma medication, believe them. Recognize asthma symptoms. Do not leave student alone. Treat with medication following doctor's order. Encourage student to sit quietly. Have student take slow, deep breaths in through the nose and out through the mouth. How to use an inhaler. Remove cap. Shake 3 to 4 times. Prime by pressing top of inhaler twice. Wait 1 minute. Have student stand up. If spacer available, attach to spacer. Press top of inhaler 1 time. Breathe in deeply for 1 breath. Hold breath for 10 seconds. Repeat from step 4. Have student rinse with water and spit. Notify parent. If symptoms do not improve, can administer second dose if it's stated on the doctor's order. Call 911. Documentation. Minimum documentation on medication log. Go to date. Write time medication given and initials of care manager in the appropriate box. Write initials and name on designated lines lower right front of log. Best safe practice documentation. Document on front of log as stated above. On the back of log, write date, time medication was given, what student said, dose, parent notification, and outcome. For example, 2/23/17, 8:30 a.m. I need my inhaler. 2 puffs. Felt better. Parent notified. Care manager's signature. How to use a nebulizer. Wash hands. Plug machine into wall socket. Attach end of nebulizer tubing to air outlet. Twist top off medication ampule. Add pre-measured medication to nebulizer cup. Screw top on nebulizer cup. Attach connecting tubing to nebulizer cup. Turn on power switch. Make sure the mist is visible and start treatment. Place mouthpiece in mouth or mask over face. When mist is no longer visible, turn off power switch. Have student rinse mouth with water and spit. Remove nebulizer cup from tubing, rinse cup with water, and allow to air dry. Documentation. Minimum documentation on medication log. Go to date. Write time, medication given, and initials of care manager in the appropriate box. Write initials and name on designated lines lower right front of log. Best safe practice documentation. Document on front of log as stated above. On back of log, write date, time medication was given, what student said, dose, parent notification, and outcome. For example, 3/21/2017, 11 a.m. My chest feels tight. Nebulizer per doctor order. Felt better. Parent notified. Care manager signature. Allergies. Severe allergies. Common allergic symptoms: wheezing, coughing, difficulty breathing, tight chest, chest pain, stomachache, nausea, vomiting, restlessness, anxiety, impending doom, itching rash, hives, bright red skin, dizziness, fainting, swelling of the face or body, swelling of the lips or throat, feeling of something in the throat, trouble speaking, swallowing, hoarse voice, pale or bluish skin color, especially around lips and nail beds. Emergency care for allergic reaction. Recognize symptoms of an allergic reaction. Give EpiPen. Call 911. Contact parent or guardian. Encourage student to stay calm. Reassure that medication will help. Have student take slow breaths in through the nose and out through the mouth. How to use epinephrine. Grasp auto-injector in the middle. Follow instructions on auto-injector. Swing and firmly push tip against outer thigh until it clicks. You do not need to remove any clothing. Hold in place for several seconds. The specific time to hold in place is located on the auto-injector. When in doubt, use epinephrine. Always give the used auto-injector to EMS when they arrive. How to use AuviQ. Grasp auto-injector in the middle. Pull the AuviQ from the outer case. You will hear voice-activated instructions. Pull off the red safety cap. Pull back firmly to remove. Place black end against outer thigh. You do not need to remove clothing. Hold in place for 5 seconds. Documentation. Minimum documentation on front of medication log. Go to date box, write time given, and initials of care manager in appropriate box. On front of log, lower right, place your initials and full name. The best safe practice documentation. Document on front of log as stated above. On back of log, write date, time, symptom student was having, time medication was given, time 911 was called, time they arrived, time the parent was called, and the care manager's signature. Seizures. This is an emergency action plan for seizures. Receiving Diastat medication. Medication authorization form must match prescription label and must be signed by both physician and parent. The dose is located in the window on the side of the tube. Check the expiration date. Diastat will have a green ready line. If the line is red, do not accept. Parent will have to take it back to the pharmacy. Document receipt of medication, date received, number of syringes, expiration date, and dose on the back of the medication log, and have parent co-sign with care manager. This is an example of a seizure observation record, demonstrating the administration of Diastat for student having seizure. Check time seizure began. Write on seizure flow sheet. Give Diastat if seizure greater than 5 minutes or if student is having multiple seizures. Ask teacher to clear a room of students. Ensure there are no objects near student that could cause injury. Check medication order for this student, noting 6 rights of medication administration. Call 911. Put on gloves. Take medication out of container. Bend cap to side to remove cap and apply gel to tip of tube. Roll student toward you. Bend knee and move it forward, exposing buttocks. Slowly insert the lubricated tube into the rectum. Do not force. Slowly push plunger, counting to 3. Wait 3 seconds to allow medication to absorb and slowly withdraw the tube. Press buttock cheeks together for the count of 3 seconds. Student may become incontinent of bladder or bowel. If able, provide a piece of clothing or cloth to protect privacy. Keep student positioned on one side with mouth toward floor to prevent aspiration of saliva or vomit. Hand syringe to 911 personnel. If they decline, the syringe can be thrown in the trash. It's not a biohazard. Document on seizure flow sheet, time seizure began, time medication was administered, time EMS was called and arrived, time parent notified. Diabetes. Receipt of diabetic supplies can be documented on the back of the diabetic log sheet. Both care manager and parent will sign the log sheet. This is an example of a diabetes management plan for a student who will have insulin injections. This is an example of a diabetic log sheet. Scenario 1. Dee Beaties is a type 1 diabetic elementary student, and she is preparing for lunch. She washes her hands with soap and water and checks her blood glucose. Her blood glucose is 256. Her food choices are cheese pizza, 33 carbs, apple, 19 carbs, garden salad, 4 carbs, and white milk, 13 carbs. Her total carbohydrate count will be 69 carbohydrates. Dee Beaties' care plan calls for a carbohydrate to insulin ratio of 15:1. Divide the carbohydrate she will consume by her ratio to equal 4.6 units of insulin. 69 divided by 15 equals 4.6. Her insulin dose for food would equal 4 units for elementary and 5 units for middle and high school students. Elementary students round down, middle and high school students round up. The correction scale indicates that she will receive 2 units of insulin for blood glucose of 256. Total insulin to be administered would be 4 plus 2 equals 6 units for elementary students, or 5 plus 2 equals 7 units for middle or high school students. Her blood glucose is greater than 250, so she must check her urine for ketones. If ketones present, call parent, provide water, and student should not exercise. Recheck blood sugar in 2 hours and administer insulin if needed. Use correction scale to determine dose. If symptoms of nausea or vomiting, call the parent or guardian to pick the student up. Encourage parent to call doctor. Document all information on diabetic log. This graphic shows a close-up of the chart used to determine the amount of ketones in the urine. Urine ketone monitoring. How to test. To get good results, follow directions carefully. Get a sample of urine in a clean container. Place the strip in the sample. You can also pass the strip through a stream of urine. Gently shake excess urine off the strip. Wait for the strip pad to change color. The directions will tell you how long to wait. Compare the strip pad to the color chart on the strip bottle. This gives you a range of the amount of ketones in the urine. Record results on the diabetic log. Scenario 2. Dee Beaties has type 1 diabetes and she is preparing for lunch. She washes her hands with soap and water and checks her blood glucose. Her blood glucose is 78. Her target range of blood sugar is 80 to 180. The blood glucose of 78 is less than 80. Therefore, it is below the acceptable range and needs to be brought up into range. The rule of 15 will apply in this situation. Diabetes will consume 15 grams of simple sugar, like juice, and will have her blood glucose rechecked in 15 minutes. Document on log. After 15 minutes, she is to recheck her blood glucose. Her blood glucose is now 118, which is greater than 80. Therefore, her blood sugar is now in range. Her menu choices equal 50 carbohydrates for lunch. Her carbohydrate to insulin ratio is 15 carbohydrates to 1 unit of insulin. 50 divided by 15 equals 3.3. She will receive 3 units of insulin for the 50 carbohydrates. The 15 grams of carbohydrates provided to bring her blood glucose into range will not be counted. The correction scale indicates that she will receive no additional insulin for blood glucose of 118. The total amount of insulin she will receive will be 3 units plus 0 correction scale units, equaling 3 units of insulin. Glucagon. Glucagon is an emergency medication that is only used when the student is unconscious or seizing and you are unable to get them to ingest a simple sugar. Before giving glucagon, call 911. Instructions for use. Wash hands with soap and water. Flip off the seal from the vial of glucagon powder. Remove needle cover from syringe. Do not remove plastic clip from syringe. Insert the needle into the rubber stopper on the vial. Then inject the entire contents of the syringe into the vial of glucagon powder. Remove the syringe from the vial, then gently swirl the vial until the liquid becomes clear. Do not use unless the solution is clear. Insert the syringe into the vial and slowly withdraw all the liquid. Children weighing less than 44 pounds, you should withdraw half the liquid. Cleanse site on buttock, arm, or thigh and inject glucagon immediately after mixing and then withdraw the needle. Apply light pressure against the injection site. Turn the child on his or her side. When an unconscious person awakes, he or she may vomit. As soon as the child is awake and able to swallow, give him or her fast-acting sugar, such as fruit juice, followed by a snack containing both protein and carbohydrate. Document on medication log, date, time, initial in box. On back of log, write date, time, reason given, time EMS called, time parent notified, outcome, and sign name. How to use an insulin pen. Wash hands with soap and water. Put on gloves. Select site for injection. Stay 1 inch away from previous injections. Stay 2 inches away from the navel or scars. Do not use sites that are bruised, tender, or swollen. Wipe site with alcohol pad and let dry. Take cover off pen. Wipe end of pen where needle twists on. Screw needle onto pen finger tight. Remove cap from needle. Prime the pen needle by turning the dial to 2 units. Turn pen needle up and push end of pen to clear air. A drop of insulin should be visible at the needle tip. If no insulin is visible, repeat priming if needed. Turn dial dose until the number for the insulin dose is visible. Pinch and hold skin at site. Dart needle all the way into the skin at 90-degree angle. Push end of pen down slowly. Count to 5. Pull needle out of skin. Dab site with tissue if needed. Remove needle from pen and dispose of needle in sharps container. Deglove. Wash hands. Document date, time, dose, site, and initials on diabetic log sheet. How to give an insulin injection. Wash your hands with soap and water. Put on gloves. Ensure insulin is not expired. If insulin is cold, warm in the palm of hands to room temperature. Remove flip top from insulin bottle. Wipe rubber stopper with alcohol pad and let dry. Remove cap from syringe. Pull back on syringe plunger until black tip is even with the line of the desired units of insulin needed. Push needle through rubber tip of bottle. Push plunger so Aaron's syringe goes into bottle. Turn insulin bottle and syringe upside down. Slowly pull back with syringe until black tip is slightly beyond the line of desired dose. Remove syringe from insulin bottle. Turn syringe to needle up. Flick syringe to cause air bubbles to rise. Push plunger to push air out of syringe. Continue to push plunger until black tip is even with the line of desired dose and a drop of insulin is seen at the tip of the needle. Select site for injection. Stay 1 inch away from previous injections. Stay 2 inches away from navel or scars. Do not use sites that are bruised or swollen. Wipe skin with alcohol pad. Pinch and hold skin of site with one hand. Dart needle all the way into skin at a 90-degree angle. Let go pinched area of skin. Count to 5. Withdraw needle from skin. Dab site with tissue if necessary. Dispose of syringe and needle into sharps container. Take off gloves. Wash hands with soap and water. Document date, time, insulin dose, site, and initials onto diabetic log. How to use a glucose meter. Wash hands with soap and water. Open lancing device and put needle in. Take cap off needle. Put cover back on lancing device. Cock lancing device. Put test strip in meter. Match code on meter screen with code on test strip bottle. The code may be built into the meter. If so, delete this step. Test strip symbol will flash on meter indicating it is ready for a drop of blood. If assisting student, put gloves on. Place lancing device against side of finger. Push button on device to release needle. Squeeze finger below puncture to get large drop of blood. Touch test area of strip to drop of blood. Meter will time test and blood sugar number will show on screen. Take gloves off and wash hands. Follow care plan if blood sugar is out of range. Document date, time, and blood sugar reading, and initials on diabetic log sheet. This is an example of the HANDS instruction guide to delegate insulin pump therapy. Each pump is unique and will require specific instructions from the school nurse to utilize that pump.